Welcome everyone. This is Black DVM Network Topic Rounds. And for Black History Month, we are, just going all out on these events. We have today Dr. Melanie French and Dr. Tosha Starke. They are both from All for PAWS, which is a relief company in the DMV area. I'll let them introduce themselves. I won't steal their thunder.
For you to do it. I want to see what nice, wonderful things you have to say.
Okay, yeah, of course, I can do it for sure. But so they're going to be talking to us today about itchy skin, which, I'm not sure how much the other vets or assistants or techs see that in their practice, but I know that I see it a lot, and I'm usually stumped on what to do. But before we get started, I do want to give a huge shout out and a huge thank you to Hill's Pet Nutrition for sponsoring all of our Black History Month events. They are a visionary sponsor for us, which means they are sponsoring every single event this month. And we are eternally grateful for that, because it's people like that that keep Black DVM Network afloat. And then, without further ado, Doctors Tosha Starke and Melanie French have a combined 20 plus years in general practice. So they know a lot, they've seen a lot. Like I said, Dr. Starke grew up in Brunswick County, Virginia, and pursuing her passions for caring for and healing animals. She graduated from Virginia Tech. Actually, Dr. French also graduated from Virginia Tech, and so did I. So we are very proud Virginia, Maryland alumnus. Dr. Starke currently lives in Northern Virginia with her husband, and she has practiced as a chief of staff in 2 hospitals, provided medical care to shelter pets, and worked as an associate veterinarian. Her interests include dentistry and surgery, and she loves the interaction and relationships that she builds with patients and clients. Dr. Melanie French has wanted to be a veterinarian since she was 4 years old, and she's been working in the field since 2005. She graduated in the top 10 of her class. So obviously she has a lot of knowledge to share with us. Very smart. She grew up in Manassas, Virginia, and returned as a small animal general practitioner, a relief surgeon, and as a lead veterinarian and medical director before deciding to switch over full-time as a relief veterinarian with All for PAWS. Her professional interests include surgery, internal medicine, and advanced diagnostic imaging such as radiology and ultrasound. And in her free time, she enjoys mentoring and coaching youth groups and hanging out with her family. And then also she has her 2 Shih Tzu mixes, Tanner and Jake. And Dr. French likes to admit that she has a soft spot for WFDs.
White fluffy dogs.
Which will be part of the lecture.
Don't worry, we'll see pictures. Don't worry.
So without further ado, I'm going to let them take over and get us started for rounds today.
Awesome. All right. If you want to do your little spiel, Dr. Starke, I am going to share my screen.
Thank you. So welcome to everybody. Please feel free to let us see your faces. We do want to make this as interactive as possible. I do realize that it's after work, or it's been a long day, I'm sure, for everyone. So feel free to ask us any questions as we go along. We want to make this interactive so we don't put you to sleep. Dr. French and I were just kind of talking about how do we, discuss cases, managing skin cases in general practice. And I feel like, when I go to dermatology lectures with board certified dermatologists, I mean, a lot of times the clients that they're getting are the ones that, they've done everything in general practice, they're willing to spend the money. So we kind of thought we would do our lecture like managing skin on a budget, because that's what we are doing a lot in general practice. Even like Dr. French, we were just talking about a case that she had today, and the client's like, my dog's ear is swollen, we got $200, or, you know that there is a finite amount of money that you have to get this pet feeling better. And so we're going to try to do like an in the trenches kind of approach to how we manage skin disease. So please ask us questions. We don't know all the answers. We are not specialists, but we just have, learned our lessons through the School of Hard Knocks. And so we encourage you to ask questions. If you have any, if you have a way to do it better, chime in, let us know, because we're always interested in improving our technique and our medicine as well.
And then just a brief shout out to all 4 PAWS. We have some of our vets on here. We have our vet assistants and things that travel with us also here on the call. And so they'll also, we will reach out to you guys for some input and things. The good news is most of us practice just about the same, Claro and Apoquel for everyone. But if you guys have any extra stuff to add, please feel free to jump in as well as we go. And then for those of you, especially on the computer, I don't know how it works on phones and things, but there is like a little react button where you can raise your hand and that type of stuff. So feel free to do that if you have a question as we're going through, or a comment, or what you've done or what you've seen. And then, or you can just unmute and feel free to say, I have a question. Again, very informal. Thanks for some of you guys turning on your camera so you can see your beautiful faces. So let's get started. All right. So first part is basically just the history. So the biggest thing, especially in just easy old general practice, is that you should be able to start formulating your plan. And this is on derm or really anything before you even see the patient. So hopefully, if your CSR has got you a nice, history in your little appointment notes or something like that there, you should be able to get a couple clues already on how you're going to do your derm case. And so signalment for atopy, environmental allergies, that type of stuff. Somebody give me something that if you saw this on the page and they're like, oh, itchy dog, and it looks like this, what kind of itchy dog would that be? Anybody? Here's a hint in the bottom.
Anybody unmute?
Unmute, please talk to me.
Do you mean based on the picture? What would we?
Yeah, so like what type of dog, what type of breed, what type of age, what type of anything would you think, oh, he probably has some environmental allergies?
Like a terrier?
Mm-hmm. Yep, terriers for sure.
Yeah, like a poodle or a lab.
Yep, definitely.
Oh. Probably like 3 or 4 years.
Yeah, so all on the ball there. So breed, any of our little bully breeds, so pitties, English, Frenchies, the American Staffordshire Terriers that don't want to call themselves pit bulls, all those things. Especially the ones that have the white face, white feet seem to be more genetically predisposed. And so very easy to look at their toes for little red spots and all that type of stuff. So definitely the bullies. Any oodly doodly things. So you said the poodles, the golden doodles, the yada, yada, yada oodle.
Silver labs.
Silver labs, the things that shouldn't exist. Silver labs, yeah. Fawn dobies, all those fun little genetic things that they made up are no good. Terriers, we said terriers. And then others, pugs, shih tzus, little white fluffy things. Boxers kind of fall into the white face, white footed pups as well. So when you see those on the schedule, young onset of age, 1 to 3 years old, they're usually indoors, but they get worse when they go outside. The other big thing is if they just moved to the area. And so they might fall outside of that 1 to 3 year old range. So keep that in mind. If they're like 5-ish and kind of in a weird age range, but they said, oh, we just moved to Northern Virginia from Arizona. Well, yes, welcome to Northern Virginia. Your dog now has allergies. That's another big thing that I think sometimes we forget of asking where they've been, if they've traveled, did they go somewhere for the holidays, that type of stuff.
And those are my 2 dogs, by the way, that both have allergies. So they made the slideshow.
All right, so food allergy, does that change anything to anybody?
Maybe you would see it a little bit younger.
Okay. Anybody else?
More chronic all year round.
Yeah, definitely all year round for sure. So
Shepherd.
breed, who knows? Anything. Age. So yep, usually either like a less than 6 months or older, 5-6 years old or so. All right, Dr. Starke, all yours.
Yep. You can click it all in.
All right.
Dr. French is controlling the buttons. So definitely when owners start saying, especially like someone said German Shepherds, and you'll see those guys come in with the periocular dermatitis. So you want to look for the location of the lesions to kind of help you figure out, what may be going on. So if you're looking for, things like, food allergies, I was at a dermatology seminar years ago, and they talked about if you're seeing lesions or chronic infections with ears and rears, think of food allergies. So, knowing where your lesions are, just, asking the owner, well, where is he scratching? Where does he seem to be having, the most discomfort? Is he licking his feet? Is he, pawing at his muzzle? Is he scratching his underbelly? When I hear, when the lesions are like ventral, when a client comes in and it's, they say it's his armpits and his belly, I think of things like contact dermatitis. Is he laying out in the grass? Is he laying on a carpet at home that's irritating his stomach? So, definitely knowing your lesion distribution is going to help you to kind of clue into, what things you should be looking for and testing for. If they say he's a 10 on his elbows or his ventrum, you want to start thinking about things like, sarcoptes. One of the things that I am seeing more and more, and I don't know if it's doodle specific or if anyone else is seeing the same thing, but the dogs that are coming in with some of the chronic intermittent GI signs, like the doodles, I'm also starting to see like ear issues, skin issues, and the GI symptoms that are all kind of waxing and waning. So, I don't remember learning that in school, but it is something that I'm appreciating in practice. It's the dog that comes in with he's been licking his feet, and he has the non-specific colitis, the stool that's mucousy, that that kind of waxes and wanes. Those are dogs that I'm looking at. It's like, okay, is he licking his feet and causing those same allergens that are that are irritating his feet? Are they irritating his GI tract as well? So those are things, again, just, asking clients, what the symptoms are, but keep in mind, if it's that dog that kind of has the fecals negative, they're having the, the chronic intermittent colitis that are also licking their feet, you definitely want to think about, allergies.
And then we already kind of briefly covered this, but seasonal stuff. So yes, when they say, oh, it's worse in the spring, yada, yada, definitely atopy, food allergy. She said year round, agreed. And then my doctor started saying maybe a waxing and waning thing, maybe they have both. So maybe it got worse. And so we're just chasing these environmental allergies, and it gets a little better and then it doesn't. And nobody ever actually addressed maybe we also have food allergy. So keeping in mind they can have both. I think we miss sometimes. The other big thing is concurrent disease. And so when we have these guys that have endocrine hormonal imbalances, top two typically being hypothyroid, like the photo, or Cushing's disease, then those can also make it just worse. One, for any type of skin issues and itchiness and things like that. Two, it can kind of mimic an allergy disease. But the biggest thing is, what if they haven't been diagnosed? Things to look for. So if you, again, this goes part of, we're still in the history land here. So if they say, oh, well, she always has this lip granuloma, it never heals, or the hair doesn't grow back, or, it's a middle-aged female, which is usually where we see these kind of hormonal things, never had a history issue before. And now all of a sudden, she's on the same food forever. And now we have this thing going on. So there might be something else that we need to find. And so, as much as the clients, we talked about being on a budget and all this stuff, always recommending doing a baseline blood work, because if you start chasing all this allergy stuff, they're going to be more mad that you spent time and money on, the HP diet and all this stuff when it was hypothyroid, and it was never going to get better until you treated that. And so I always told, and Ann Pierce is on here, is one of my assistants from my previous clinic, and I always told them, you have to tell the client the value of your test before you tell them the price. And so don't say, oh, well, this blood work is $250. And then they're like, well, I don't think I need blood work. But if you say, well, we need to test for the thyroid and this and that, and this can cause this and X, Y, Z. So yes, I think this is, of interest. And usually they'll say, okay, do it. But if you say, well, how much does that cost? And you tell them, you say, but we're going to get a baseline, and this is going to tell us this, that, and the third, and we need to do meds. Then a lot of times they understand it more. So you can't just give them a price. We need to do blood work. It's $250. So definitely, if nothing else that you take away for any type of stuff, we talked about doing this on a budget, but you have to give them the value before you give them the price.
One other thing with the hypothyroidism, I think about that when I have the middle-aged female dog that has the hair loss that's not itchy. Those are the ones that I'm like, okay, the owner comes in for hair loss. And so you want to think about, again, just getting the sigmoid, but hair loss that is non-paritic, can be bilaterally symmetrical as well, but the thinning hair, not itchy, think endocrine.
So client observations. So we know they always like to, give you a whole book of everything they've been seeing. And sometimes things are helpful, sometimes they're not. So weeding through the helpful stuff is sometimes difficult, especially now during times of COVID. So those of you who are vets, I'm sure you're doing this whole curbside thing like we've been doing. So, you have clients that come in with a whole sheet of paper of like, on yesterday, I saw him scratch his left foot. And then today he did, and then you have the ones that are like, I don't know, couple months, I don't know, maybe, is it bad? I don't know. So hopefully, if you have some that have good observations, they can give you a number of how bad the itchiness is. So if it's greater than 5, look for a secondary infection. It's never going to get better on Apoquel if there's an infection. If they say, oh my gosh, 10 plus, they never stop itching, they'll stop playing, just a scratch, then probably more type of a sarcoptic thing. If the owner has lesions, definitely check for parasite, ectoparasites. Has it responded to steroids before? If it got worse, probably parasites that we never went after. Got better, maybe environmental. Slightly better, somewhere in the middle, food allergy, maybe. And then the other big thing that Dr. Starke added, which I completely agree about, but we overlook a lot, is recent grooming, swimming, again, history, contact with other animals. Are the other animals in the house having issues? Did they use a different shampoo this time? Were they swimming in the aquaquan? And who knows what they picked up from there. So client observations, history, again, we haven't even touched the dog and we have so much information.
One of the things with the, I usually get the client to give me the score when I initially see their pet, because I say, well, how itchy is this pet on a scale of 1 to 10? And like Dr. French said, anything 5 or greater, before I'm going to give cytopoints or anything else that helps with itching, I'm going to, do a cytology to look for secondary infection. I also use that number from the client to know if the pet's getting better, because how hard is it sometimes to figure out, okay, is he better than he was when we saw him the first time? And clients, it's so hard to get an answer, but I find that scale just gives me a good way to know, okay, he was an 8 out of 10 when he came back, because the client will say, oh, I don't know if he's better. I'm like, well, what's the number? So, using that number just kind of helps me to know, well, if he responded, if he went from a 7 to a 2, then we're doing pretty well, because the clients might say, well, he's still itching, but he's not itching at a 7 anymore, he's a 2. So that tells me that we've made progress. So I find that scale just very helpful in being able to figure out, getting a more like definitive answer from the client as to if our therapy is working or not. And I put that in the chart so that the next doctor that's coming along, especially being a relief vet, I want them to know, if I say patient presented for being itchy, well, how itchy was he? So that way they can understand if they're seeing my recheck that Fluffy was a 7 out of 10 the first time, the fact that he's a 2 today, we're making progress. So, I recommend, encourage you to incorporate that scale just to help you, and also to communicate with other, vets as well.
Yeah, being objective for sure. It's just like saying, oh, well, his heart murmur's loud or it's soft. Well, is it a 1 or is it a 6? My loud is not your loud. My 2 might be your 3. And so anything else like we quantify, blood work is numbers. We need to quantify this as well. So absolutely, I agree. So grooming dermatitis, these are definitely things that can sometimes trick you and you can think it's something else. So again, the history comes in handy before we start skin biopsying for lymphoma. Oh yeah, they cut him too low or whatever the case may be.
And usually the lesions for grooming dermatitis, that was on one of the vet to vet, I believe the other night, on just a vet was like, what is this? Usually those lesions are all along the back. Like that's the only distribution. So it's usually the dog that comes in that smells like he just got a bath. And you ask the owner, they bring him in because the dog is really painful when they touch his back. And you're thinking, okay, is it a herniated disc or something? And you pull back the fur and you see all of these lesions, but it's classic. I mean, it's usually just right along the top. It's where they're like scratching when they're shampooing the dog. So getting a good history is definitely one of the ways that you get to the bottom of this. Because like Dr. Fern said, like this is a dog, if it hadn't been groomed, we're probably gonna be doing some biopsies and some skin cultures here pretty soon. So, you can get to the bottom of what's going on just with knowing the history on this patient.
All right, so we're gonna go to diagnostics in a second. Any questions or comments, concerns on signalment history, gathering information before we even start doing diagnostics?
You want me on diagnostics? Sorry, we're on a different location, so we're going back and forth. You want me to do this part? Or?
Yes, ma'am.
Okay.
All good.
Mm-hmm. So in clinic tests, cytology. You know, it's for skin. I don't know how you ever figure out what's going on if you don't do cytology. So even if it was done before, for me, if I see a patient that came in for, you know, a bacterial for staph pyoderma, if it was a 3+ cocci, I'm going to repeat it today to see if it's, you know, if it's gone, or, you know, if it's a 1+ cocci. Definitely ear cytologies. I can't tell you how many times technicians will say, or even other doctors, well, his ears look better on the recheck, we don't need to do a cytology. But I can't tell you how many times I found yeast on that same patient, and based on the cytology needed to treat longer. So, you know, again, like Dr. French said, you want to explain the value to them before the cost. But, you know, cytology in most clinics is not expensive to do. It's quick, it's easy, and it gives you so much information. I found Demodex before on just a skin, just a tape prep. I mean, my goodness. I mean, it's, you know, what an easy way to figure out, you know, what the issue is. So a couple different things that I'll do for checking lesions. I do like, of course, the 2-sided tape works really well. I have a little spatula that you can just kind of, you know, move the little crust on the lesion because you want to get like underneath the lesion. So, you know, for the best sample. I actually was at one clinic the other day that had sticky, the slides actually were sticky.
Yeah, so I had to, yeah. I was like, that
was awesome. I mean, whoever invented that, they're my hero. But they literally, and I can figure out what I'll find out what the name of the company is. Feel free to, I'll pass it on to everybody. But it was awesome. You literally just take the slide and you press it along, you know, between the toes, and that way you do your cytology. But get in the habit of doing cytology every single skin case. I mean, there's very few, if it's a dog that comes in that, you know, I'm rechecking, they're still on the meds, they're not, you know, remarkably better. I may not do a cytology, but I'm going to still tell that client, we're going to follow up again in 2 weeks, and then we're going to repeat that cytology. If I've done my preliminary, I know that it's staph, it's responding, but it hasn't, you know, completely gone away, then, you know, I may skip that time, continue our therapy, but I still want to, you know, a time to check to see how things are going. But again, cytology. Of course, mineral oil for ear mites. You want to check for ear mites, and even on dogs, because very recently I practiced for 17 years and I probably have seen ear mites in 3 dogs, but they're there. So don't forget, with dogs with itchy ears, and they don't always present like the cats do with the coffee grounds. It can look just like, you know, a yeast otitis. So do look for ear mites. It's quick, it's easy, and it gives you a lot of information. Skin scraping. So Dr. French and I were kind of talking about this. So I don't do skin scrapes as much now, especially with medications like NexGard. You know, back in the day, you know, before we had medications that would empirically treat those, I did them more. However, if a client comes in and their dog is a 10 out of 10 itchy and he's a hunting dog and the client's itchy too, you know, do the test for sarcoptes. I mean, even just kind of CYA to say we look for sarcoptic mange, but of course, you know, with the preventatives that like NexGard, that's, you know, that drug, that line of drugs, we can empirically treat, and we should, because it treats for fleas as well, which could be part of our problem, and we do want to rule it out. So cytology. Along the same lines, aspirate. So when lumps are present, I apologize, my Frenchie is running in here. He's without his mom for 5 seconds. So you always want to aspirate lesions. And I have this picture up here. This was a lump that was deemed a lipoma that the owner said, you know, it never was aspirated. I was told it was a lipoma. And I said, well, we don't know what it is until we aspirate it. So I took a picture to just remind us that you don't know what it is until you stick a needle into it. It was a mast cell sarcoma. So, you know, if the owner declines, I get it, but you want to put that in your record to say that the client declined me aspirating this lump, because you don't want to be the one that, you know, had the mast cell tumor go undiagnosed. Yeah. Does everybody get the point with cytology? So this is just a smear. It's an itchy dog, and it's just malassezia. This dog is probably intensely itchy. And so, you know, a lot of these cases, you're like, okay, they're not getting better. We have them on antibiotics, but it's because it's a yeast infection. So do that cytology to know what you're dealing with. That's probably a dog that's greater than 5 on that itchy scale that comes in. If you give that dog Cytopoint and send it home, the owners are not going to be very happy that they spent $100 on an injection and their dog is still itchy. So do that cytology. And this is just, it's a suppurative dermatitis. So it's just, again, doing your cytology to know this is a, you know, this is a bacterial infection. We want to put that dog on an appropriate antibiotic, and, you know, and not only just orally, but also, you know, topical therapies. So cytology, cytology, cytology.
And this also goes back to the point of doing it even if it was either done before or not done before. Because also times being relief, you know, we go to all types of clinics. We go to the AHA ones, we go to the backwoods ones as well. And, you know, there's ones where they say, oh, well, you know, last time I was here, you know, last time he had this infection, he just gave me cephalexin and it's fine. And it went away. Okay, well, then you also came back a month later for the same thing, and you came back a month later for the same thing. So it didn't go away. And when you can finally convince them to do the cytology, they end up with the yeast. And so that's why it never got better on cephalexin. And so definitely, again, especially with, because there will be owners who fuss and fight at you about, you know, it's always the same thing. Can't I just get the medication? Blah, blah, blah. Again, Dr. Stark saying CYA covering your tail. You know, saying, well, I told him that this is probably not going to work. And remember, it's your license. So if you don't want to just start throwing antibiotics at them, you shouldn't. And you are well within your right to say no. And so that's another big thing too. Just no, I'm not giving you another bottle of Lotamax. I'm not giving you another such and such without doing the ear cytology, without doing the whatever. And if that's an issue, they can go to another doctor.
And prepare the client for the follow-up. So what I generally will tell my clients when we're at that initial appointment, I say, okay, but I want to see them in 2 weeks, and we're going to need to repeat that ear cytology. So again, you know, communication, that's where, you know, they say most board complaints are from lack of client communication. So communicate with that client and say, we're going to repeat this, and it's going to cost, you're going to have to pay another $35. I know that's a lot of money, you know, I empathize, but we're going to need to do that test because that's how we know if the infection has resolved. We want to know if the next time he comes in for this, is it that we were treating a resistant infection or is this a recurrent infection? So those are the things that I communicate with clients to be able to, you know, I've already prepared them. If I'm not seeing that case, I've already made it easier for the doctor to kind of see them because the client is expecting to have to pay versus they always think the recheck is supposed to be free. So prepare those clients. Save some time in the future.
So anybody help us with this one?
Oh, sure. You know, I like the cytologies. So this is just a bacterial infection. So again, you have confirmed that you have bacterial cocci. And so that's why you want to get these cytologies. I've seen cases where you do the cytology, you see bacteria, you check them in 2 weeks, it's a yeast, you see yeast. So now we have to go back and treat for yeast. So that's why you do it. Because if that dog is still itchy, it's not because he needs more antibiotics. He needs to now be treated for a yeast infection. So do those cytologies.
Can anybody in the audience tell us what this one is before Dr. Stark says it? Anybody? Take a guess.
Come on, y'all.
I know it's small, sorry.
Can y'all see what it is? So, all right, I guess everybody's asleep on us.
I mean, I was going to say, I mean, it is small, so I'm like trying to, oh, okay.
Did you see it?
Yeah, I did. So.
Melanin granules.
So yeah, those are melanin granules. I find that I get asked that question by technicians a lot, if that's bacteria, but I mean, the difference is they stain brown. And so it can be easily confused for bacteria, but those little dots, and a lot of times you'll see them like the one you can kind of see, it's like laying on top of the epithelial cell. So usually it's associated with epithelial cells, but those are melanin granules, not to be confused with bacteria.
And that's the same stain, right? Like you guys still did.
The thick stain, yep.
Yes, it's the same stain. So that's a good one to know. That is not bacteria. And they are smaller. If you look at a bacteria cocci on the same tower, they are way smaller than cockeyed. So just sending your cytologies, your masses, your punch biopsies, skin lymphomas, all the things that you will send for testing. Dr. French and I were just talking about how we love the ringworm, the PCR testing now. It's just, you know, quicker.
I always know when I went to a clinic after Dr. Lewis, because they've had the ringworm PCR.
That's right. That's right. So no more DTM cultures in house, because, you know, how many times do people forget to check those for 3 days? And so the good thing about the ringworm PCR, is anybody familiar with the PCR, the ringworm PCR? So it just, I think within 3 days, they give you, if the patient is PCR positive, if they're positive, they're positive. If they're negative, they actually do the full culture for 14 days. That's your understanding, Dr. French, but I like it because
I'll also tell you what it is, like if it's the microsporum gypsum or this one or that. And so all of the like, oh, this is the one that's from soil, or this is the one from whatever. Because theoretically, when you do the DTM culture in-house, once it grows something, you're actually supposed to take a sample, put it on the slide, do a cytology, look at the, you know, the microkineta and all that stuff, and nobody ever does it. They're like, oh, it's positive. So this one, you take your little toothbrush or you pluck some hairs, put it in just a regular old white top tube, like you put the urine in, and send it off. And they do the PCR.
I will say that the ASPCA, we use the ringworm PCR to IDEX to clear our cats, especially our foster kitties of ringworm. So like after treatment, most of them will get a ringworm PCR test sent out for adoption.
Yeah. And then again, you don't have to keep the negative DTMs back to back and all that stuff and all this. Anything to add? Is Dr. Lewis on here today?
I had no idea about the PCR. I'm definitely that person
I think
for way too long. So that's
it's awesome. That's awesome.
Yeah, it's definitely game changing when it comes to treating diagnosing ringworm. So allergy testing, Dr. French and I were talking, we think Heska is probably like, you know, leader of the pack when it comes to testing and doing immunotherapy. I always tell clients that the only reason I would recommend allergy testing is if they plan to do immunotherapy, because if not, who cares what they're allergic to? They're just going to put them on Cytopoint, you know? But if it's a client that really wants to, can you hear me still? I'm sorry. Okay, sorry, my thing, it's an internet connection weird. So if the client is not willing to commit to do immunotherapy, I can't really think of a reason to do the allergy testing, you know, because you've already treated them for fleas, you're already, you know, and you're not going to do the testing for food, because the food allergy testing we all know is not recommended. Food trials are. So I usually have the conversation with the client that if we're going to do the allergy testing, our goal would be to do immunotherapy. I explain what that means. It can take 6 to 12 months for the pet to respond. So a lot of times you will continue Apoquel and Cytopoint in the meantime. And you also want to tell them that, 25% may not respond. And then depending on where they live, they can continue to develop other allergies that may not be included in that serum. And so, the recommendation is to test them, I think, again, 12 to 24 months after starting that therapy. So it is the gold standard for testing, for IDing what they're allergic to, but I don't do it as much anymore. Again, from a practical standpoint, if I can keep that pet comfortable right now, and the client has a finite amount of money to spend on the skin case, maybe we take the route of doing Cytopoint if it's a seasonal issue and the seasons that they need it, versus doing immunotherapy, which is labor intensive for the client to give injections. And so, some might disagree with me, but that's just kind of how I think through managing. I have allergy dogs of my own. One I did immunotherapy with for years until Apoquel came out. I'll never give her another allergy shot ever again. She's seasonally allergic. I can keep her comfortable in spring and fall. We party in summer and winter. So, she has no issues with summer and winter. So again, just have a conversation with the client, with their expectations. I still do have clients that say, I want an allergy test. I want to know what Fluffy's allergic to. That's okay. That's fine. If you want to spend $300 to just know that Fluffy is allergic to, house dust mites, and then, fine, but I just have that honest conversation with them. And again, testing, blood testing for food allergies is not recommended. I kind of cringe a little bit when I see that, spending clients money on doing the food testing when every dermatology lecture that I've ever been to says that it's not worth their money. Spend that $200 on some Cytopoint.
Exactly. Yeah. But I mean, and the panels are out there, so you can get a HESCA test for, you know, food allergy and stuff. And some people want the full panel. And again, I always document, like, told owner that this is not the best, blah, blah, blah. And if you want to spend it, you want to spend it. Let me see, Dr. House says, I like to tell people that HESCA reps tell you not to run the food allergy panel. Correct. Yes. I've actually had a HESCA rep say the same thing as well.
Yeah.
Going back real quick to the ringworm PCR, Dr. Lewis put in the chat. The Antec also does the PCR as well. So that's a good thing, especially I know some clinics.
Dr. Lewis would know that.
Yeah, that's why I was like, anything to add? Because I know I had not heard of the ringworm PCR until a year ago. And I was like, what is this? You know, I was doing a recheck for one of her things. And I'm like, what is this magic on here? What is this thing? So yeah, so great. And then also with the allergy testing, IDEX also does the allergy testing panel thing. But I think HESCA is probably the biggest name, but IDEX will make their own little immunotherapy shots, sublingual stuff too, from whatever they get from it. So I know some people, if you work at like a corporate clinic or something that gets like a good IDEX deal, then that might be beneficial to you and to the clients maybe. I don't know if it's like a special test so that they won't do the deal with it, but that is a thing. And then, yep, gold standard is intradermal testing at the dermatologist. And so people really want to know, they probably should go there, but.
So skin cultures, you want to do that part?
Yep. Okay.
So skin culture. So for me, after I have used 2 antibiotics for an appropriate amount of time, an appropriate dose, and I usually will do topical therapy at the same time if I'm doing orals, as long as the client can do the mousse or, you know, what have you. If that skin infection, I've confirmed it by cytology that it's staph and it's not gone or comes back pretty soon after the last dose of the antibiotic, then I'm going to do a culture to look for MRSA or methicillin resistant infections. They are more common. I'm seeing them more and more, and I'm not sure why, but maybe, you know, because we're using so many antibiotics and they're becoming resistant. But you shouldn't have that dog on the 4th course of cephalexin and you've not thought about doing a skin culture or talk to that client, because, you know, we do have liability in that there is a low potential for people to get these infections from their dogs. I think a while ago, a study was done that showed like a lot of the MRSA infections that dogs had were from, you know, they got them from the people. And so, you know, there is potential to go back and forth. There's a low potential, but there is potential. And so when I'm dealing with methicillin resistant infections, I've cultured it. I'm going to use topical therapy as my hallmark therapy. Like that's what I'm going to aggressively be using. Chlorohex bathing, and I let the client know that, listen, we have an uphill battle. This is a really resistant infection. And, you know, I've had these dogs come in with the infections in their nasal cavity because it's been on their skin for so long. Lord knows we get it in an ear. I mean, so you want to make sure that you just are honest with this client about, you know, treating this aggressively. Make sure there's no underlying disease with this animal. Are they having this MRSA infection because they're hypothyroid? And so, you know, just making sure that there's no concurrent illness going on as well. But again, my rule is if you've used 2 antibiotics for an appropriate amount of time, for appropriate dosage, if that infection comes back, if it never goes away or it comes back very soon after you finish your therapy, recommend a culture because it's very likely a methicillin resistant infection. Topical therapy for those, again, I can't state it enough. You are going to concentrate that antibiotic on the skin a lot. You're going to saturate it, you know, a lot easier, and it's going to reach therapeutic levels easier than oral therapy. So in addition to oral therapy, I'm also doing topical mousses, trizchlor spray, and I know we'll talk about that a little bit here soon. Ear cultures as well. Dr. French, I'll let you do, because you like the ear culture part. So.
Yeah, love the ear culture stuff. Actually, my client that almost made me late for the meeting today probably should have done an ear culture on their dog, but ear cultures, the biggest bane of my existence are the dogs that the doctors have just continued to just give them Otamax. Owner called again, needs another refill of Otamax. Okay, refill it. All those swimming labs and all that type of stuff, the bulldogs especially. It always clears up on Otamax. Let me just get some more Otamax. And then when they finally come in, because it keeps coming back and we can't get it better and they're so frustrated, that's usually when we end up seeing them. And, you know, you look in there, especially the ears that have that gross creamy discharge, typically some type of secondary pseudomonas, something like that. Most of those are the ones that have these methicillin resistant staph that she was talking about. And so again, explaining the value of the fact that, hey, you know, ma'am, you've been paying for all these recheck visits, all these exams, all these ear cleaners, you know, multiple bottles of Otomax and all this other stuff, and we're still here. Let's invest, go ahead and pay that $200, whatever it is for the culture, and see what we get back. And so always with these ones that have the chronic, you know, always try this, and it always did better before, but it just comes back type of dogs. I always recommend the ear cultures for them. And so ask for, sometimes you have to ask for the fluorophenocal susceptibility specifically. And so I would just put that on there for my notes when we send it into IDEXX, you know, please test for fluorophenocal. That's what's in Claro. And so we'll talk about that later, but that's the leave-in treatment. And so that works well for them. The biggest thing with ear cultures though is unless you see white blood cells on your cytology, again, cytology, unless you see white blood cells that would indicate maybe an inner ear, middle ear infection, you need to use topical medication because it does not, the oral, you know, throwing them on oral Baytril because that's what your ear culture said it's sensitive to, does not mean it's going to concentrate in the ear canal well enough, in the external ear canal anyway, well enough to take care of what's going on there. Now, it's one thing if the ear is so gross that, you know, the skin is also infected and all that stuff, and you've done a swab, you see some bacteria back there too. Yeah, okay, we probably could use some oral stuff. But Wedgwood is a compounding pharmacy that I love, and they make these OD packs, anhydrous lanolin. So basically, it's like a Vaseline consistency in a huge 15 mil syringe. And so using, you know, 2 to 3 mils at a time in those ears, and they pay $50, whatever it is for the syringe, but you get a lot of uses out of it. So that's typically my go-to. And you can go to the Wedgwood website and pick and choose, you know, amikacin plus the fluorophenocal plus the whatever. Pick 2 or 3 that are, you know, susceptible on your list there and using that. And so I'm huge on the Otopax, and then you're the hero because now you finally fixed this ear infection that never went away. But that's my spiel on ear cultures. I always recommend it, especially for the long one. I see in the chat, yep, other people like some. Roadrunner makes great Otopax. Yes, agree. The biggest thing is,
one of the things
I was just going to say, when you're ordering them, you know, making sure you're getting, 1, the medications you need, but also 2, the amount that you need. And so if you get like the smaller 3 cc syringes, you have to make sure that you have enough for at least a couple doses, because now these chronic ear infections have been there for months. And so I always tell people, you know, you can buy, you know, 6 to 8 of the small ones or buy 1 big one. So being careful of which OD packs you're getting for that too. Yeah, Dr. Stark, you want to say something?
So a couple of things. So one of the tricks that I've learned with treating these really, really nasty chronic ear infections is not putting the medication in the day that they come in. So again, I was at a dermatology lecture that talked about getting the pain and the inflammation down first and having that pet come back to instill the Claro or to instill the OD pack. Because number one, that ear hurts. Like, who wants some medication shoved in your ear that's had, you know, Pseudomonas for the last 2 years? So what I've started doing with a lot of these really nasty ear infections that you can smell across the room, I send that pet home with a course of, you know, carprofen, Apoquel to get that inflammation down. If I'm thinking it's a food allergy, we're trying to get them on a hydrolyzed protein or a novel protein. So I had the conversation with the owner and I say, gosh, Fluffy has a horrible infection. But first, we're going to get this pain under control because Fluffy, number one, the medication is going to penetrate the tissues better if it's not inflamed. So, and usually when you're ordering the specialized OD packs, it takes a few days anyway. So what I do is I get that pet and I can see the difference. You know, I've done it different ways over, you know, a number of years when I used to, you know, shove the medication in because it's convenient for the client while they're there. But I see the difference in the patients and how they respond when now the pain is gone, and then you can see the ear canal better, and then you put the medication in. And owners, I feel like if you have that conversation with them, they appreciate, most of them. It's always going to be the one that can't come, you know, because they're busy, but, or, you know, or having a hard time getting back. But it works better, and the owners appreciate that you're trying to get the pain down before you treat that ear. And so the other big one that we were talking about, methicillin resistant, but Pseudomonas is the other big one in the ear. And usually my thing with those is you can smell that dog coming down the hallway when they have Pseudomonas. So if that ear smells so bad, it's like clearing a room. Don't just send that dog home with Otamax. Let's get a culture. Let's figure out what's going on with that ear, because it's not going to get better with some Otamax.
Agreed. Or Baytril Odipac. That's the other thing too. BKT Odipacs.
Yes.
They usually have had a couple of those as well. All right, treatment. So this is the part we've all been waiting for. So you had your signalment, you had your history, you already had a plan before you even saw the dog. You did your diagnostics, you found out whatever is going on there. Great. Sent out extra diagnostics if you needed to the lab, and then now finally treatment. So again, balling on a budget type treatment here. These guys. I put this in here. No, Zoetis is not paying us. However, Apoquel and Cytopoint has just made life easier. They're expensive, and so clients typically, it's hard to get them to go for it. But when you start talking about the value of it over the price, then they usually get it. And so this is kind of the Zoetis rundown of how they recommend doing itch relief and things like that. And so you'll see this anytime you go to a Zoetis lecture and stuff. And I thought this was a good slide to start with, because you can use Apoquel and Cytopoint for intermittent things, for long-term things, for fleas, food, seasonal allergies, where you're trying to figure out what the heck is wrong with these dogs. Using this to, like Dr. Stark said, make them comfortable, so they actually respond to what we're trying to do, and it buys us some time to wait for the culture results and to wait for all that stuff. We do need to stop the itch first and then start figuring things out. So I really like both of these together or apart.
And I think you can allergy test. I'm pretty confident you can allergy test while they're on Cytopoint and Apoquel as well. So it's not like steroids where you have to take them off for a certain amount of time. If the client, after you gave your spiel and they do want to allergy test and do immunotherapy after you've given the Apoquel, you can still do their allergy test.
Agreed. All right, so most common. So when I say most common, I mean Dr. Stark and mine favorites, but most common for us to use. All right, let's get a whole list here for a sec. Okay. So topical stuff, we love it. Dr. Stark already said it, we love it. It's great. As relief vets, as soon as I go into a new clinic, I go to their pharmacy and say, do you have shampoos? Do you have mousses? Do you have wipes? That's, especially now in this area, that's the only way we can get through a day. There has to be some type of something for them. And so trichlor spray is great. We like the Duoxo mousses. Bathing, my favorite is the Phytovet CK. I like the Phytovet line because it has the PS in it, the phytosphingosine, which is putting the lipid barrier back on the skin. And so when you're telling them to do 2 or 3 times a week bathing and all that type of stuff, we are also trying to put that skin layer back, that barrier back of they've been scratching and itching and messing up this whole time. And so I really like the Phytovet line, the ones with the phytosphingosine in it. CK for Chlorhex and ketoconazole is what's in that one. That's usually my go-to. The Duoxo Chlorhex mousse also has the Chlorhex and ketoconazole. Unscented baby wipes, always helpful too, especially with these ones we said their feet and their lower legs and all that type of stuff. When they come in from outside, they need to be wiped down. You need to get all of the allergens off. So just making people mindful and aware of that. Anti-itch wise, Apoquel versus Cytopoint. So again, on that previous slide, Apoquel I like, and I know Dr. Stark and I were talking, for kind of that immediate itch relief type of a thing. Think anytime where you would have thrown them on a steroid, be like, oh, we just need steroid real quick. That's kind of the Apoquel thing. It's labeled to stop the itch within about 4 hours. And so it works well and it works fast. And so we like that. On the previous slide, typically in all their paperwork and stuff, it says to do it twice a day for 2 weeks. Again, expensive. I have had a Zoetis rep tell us that you really only need to use it for about 7 days at that twice a day thing. So there's not like a loading dose. It's kind of more so of till you get that initial insult and injury under control. So personally, I don't know what you usually do, Dr. Stark. I usually do it twice a day for a week instead of the 2 weeks to try to keep the price down. And then say, if we're feeling better, and because you're now on your ketoconazole, you're on your topicals, you're on your antibiotics, the infection's getting under control. And so switching them down to the once a day maintenance helps them stretch out that that Apoquel. Is that how you usually go? Do you do the full 2 weeks? Yeah.
So it depends on the patient. It depends on where they are on that itchy scale. It
Yes.
depends on how much money the client has.
Correct.
So, I mean, in an ideal world, I want to do the first 2 weeks twice a day. If they're a really, really itchy dog, if the owner's like, oh, it's a boxer, it's like $150. And I will say, you can start with once a day, or twice a day for like 3 days to kind of get that initial inflammation, get the initial itch. And then usually I'll go to once a day. But it really just, I really tailor it to the client and the patient and how itchy they are.
The clinic, because it depends on how it's priced. I mean, there's some clinics where I'm like, that's a great price for 60 milligram Apoquel. You better take all this stuff.
Absolutely.
Places where it's just not. So, Cytopoint for long term for sure. Kind of maintenance we were talking about. That's usually when we use that. For those who can't take pills, if they can't give it consistently, sensitive stomach dogs, even though Apoquel and stuff hasn't been shown yet to cause any issues with liver and kidneys and things like that, it is still a drug that needs to be processed. And so if people are concerned about that for their older dogs and stuff, I usually lean to Cytopoint as well. Atopica, cyclosporin used to be the big thing. Definitely a strong immunomodulator. But again, then we're also opening ourselves up to other things. So people that we can't trust to come back properly for rechecks and, checking lab works and stuff, probably not the best thing for us. But when all else fails, Atopica is definitely something to do. Steroids, like I said, I still use them. I will use them. But again, being mindful and documenting that you told them that there was something else you preferred, or that you talked about all the risks of the steroid and yada, yada. And so definitely documenting nowadays, because we have so many other options. I always say, well, offered Apoquel and Cytopoint, if they declined, did a very short course of steroid. Usually I tell them, if we're going to do it long-term, we need to do blood work. So again, just kind of covering for sure. Antibiotics, the biggest one you always see, convenient injections, Simplicef, cefpodoxime, cephalexin, again, money-wise, size-wise, if they can't do the Simplicef, depending on pricing. For minor things, cephalexin works pretty well for skin stuff. So I will use that at times. And then antifungals, ketoconazole, terbinafine. So we're talking topical Lamisil, the over-the-counter human athlete's foot stuff. Lamisil actually has terbinafine. So I've used that before topically for dogs and stuff. We see dermatologists use fluconazole. Is anyone else using this? Good question. What are you using?
I was just going to say terbinafine. I do love that one for clients that are like, gosh, the ketoconazole, like I have, it's a huge dog and he's got to take, 200 milligrams twice a day. And so I love terbinafine for that. And also for refractory ringworm cases, or just for ringworm cases in general. It's like $4 for a month supply at Walmart. Yeah. So, and it's very safe. So I love terbinafine. I started using that at the shelter and it's been game changing.
Yeah, definitely. And then ringworm mice, so you say, yep, terbinafine, Tresederm is actually labeled topically for ringworm stuff. And so you can definitely start that for your kind of questionable ones while you're waiting for the 3-day PCR. It's not going to hurt anything. If you're not quite sure if it is and not quite sure if it's not, lime sulfur dips is definitely the old school way of doing it, but still works. Itrafungal is the new hotness for kitty cats. I think I might. Did I put a picture on here? No, I didn't. Itrafungal is a liquid that, what is it? 1 week on, 1 week off?
1 week on, 7 days on, 1 week off for 3 treatments for cats.
Yeah, so it is definitely helpful for cats and ringworms. So again, we finally have good stuff and better stuff.
Very easy moving. It's game changing.
Yes, for sure. Let's see what else. Zoonotic. So yes, definitely want to keep them up to date as far as ringworm stuff goes. Others, and so again, we're treating infections, but maintenance. So being upfront and honest with clients, like Dr. Starke was saying, and letting them know that this is a long game. And so we're treating the current infection, but we also need to be mindful of maintenance. So Wilactin is our favorite. Has high DHA, EPA values in it and concentrations. And so instead of people saying, well, I take fish oil at home, I'm just going to use mine. The concentration that dogs need and things, and they make it for cats as well. Wilactin is our favorite. So if you haven't heard of that, that's something I would recommend. It's a supplement, so they can get it on Chewy and Amazon and all that stuff. But a lot of clinics carry that And then antihistamine wise, I like hydroxyzine. Well, Zyrtec, same thing. The metabolite of Zyrtec, hydroxyzine. But for our bigger dogs, because the hydroxyzine comes in 50 milligram tablets, that seems to work really well for them instead of having to give them 3 Zyrtecs. So using that, Benadryl, obviously everybody knows about Benadryl. So that's that. And then flea and tick preventatives. This is part of your treatment plan. They have to be on a flea and tick preventative. Ideally one of the chewable ones so that we can cover our bases like we talked about before for Demodex and off-label stuff, Sarcoptes and all of that goodness. I typically still will do just the once a month treatment. Dr. Stark, do you ever do the every 2-week thing? Okay.
No, I mean, I find it still effective with the once a month, especially if I'm just treating empirically. I mean, if it's a patient that, I mean, even the Sarcoptes dog that I had, I just did it once a month. I mean, confirmed Sarcoptes, and it worked very well. Yeah, so I don't increase the frequency.
I do the same. Yep, I just use it at label dosage, and it's been on Ven and different things like that. That seems to work. And so I keep it at that. My little aside for Bravecto is for those who have not read the label. It's only labeled for 8 weeks for Lone Star ticks. And so when we give Bravecto to clients and say, oh, give it every 3 months, if you're in an area like we are here in Northern Virginia, where the ones I probably see the most are Lone Star ticks. And so technically the people should be giving it every 2 months. And so if they're paying for a tablet that's, $60 because it's supposed to last for 3 months and you're telling them to give it every 2 months, they might want to just use Simparica or Simparica Trio or something like that instead. So I always make that disclaimer when I'm at clinics that use Bravecto and push Bravecto a lot to clients if they ask me which one I prefer, chewable tablet. Bravecto is typically not my favorite just because really you should give it every 2 months. So that's my little soapbox for that. For those who are unaware. Our favorite ear things. There it is, Claro, the best.
I guess with the Claro, one of the things that we were just chatting about last night too is making sure that you're only using the recommended ear cleaners when you are applying Claro. The company doesn't put this on the label, but they say to use either what Triz Keto or Triz EDTA. You're not supposed to use other ear cleaners because it can deactivate the medication. Not really sure why they don't tell us this, but I had several cases that Claro was not working, and I'd used it for a while, and it was really helpful. But the difference is, I'm traveling vet. The one clinic that it was successful, they were using Triz Keto to clean the ears, and the other one was using like a Pharmaceb or something like that. Mm-hmm. So you do want to make sure that you're using the appropriate ear cleaner prior to applying Claro. And again, it doesn't say this on the label.
And for the doctors and assistants and anybody else that's here on the chat with us now, I would encourage you to, if you are not the lead vet or whatever the case may be, and you guys carry Claro, to mention it to whoever your lead is at your clinic and see if maybe you should put a sign or something like that. Actually, the clinic I was at today, I told them, yep, okay, clean the ear and put the Claro in on this dog. And the tech actually asked me, she said, oh, that's the one we're supposed to only use the Triz EDTA with, right? And I said, actually, yes. I'm glad you know that, but yes.
I told her that the other day. I know where you were.
Yeah.
That's exactly why we do.
Oh, yeah.
There you go. Pharmaceb, and I said, no. And so I'm not really sure why the company doesn't put this on the label, because, and they're going to have issues with it not being effective. Dr. Lewis just chimed in and said that it has to be a neutral pH ear cleaner. So, and it also says, Dr. Kraut chimed in and said that the ear should be pretty dry. And it does say that on the label, that the ear should be dry for application of Claro.
Yeah. All right, perfect. And so let's see, we went through all this stuff, right? So you have
like I usually go with Triz. Can you hear me?
Uh-oh. I don't know if you're breaking up or I'm breaking up. Go ahead, say it again.
Oh, it's probably, sorry. Go ahead, you go ahead.
You were saying something, you use Triz something.
You go ahead.
Oh.
No. So just as a maintenance, I do like the Triz and the Triz Keto for maintenance. But I usually will tell owners, especially if we're doing either Ocernia or Claro, I make sure to tell them no bathing, no cleaning the ears, because owners, I don't know what it is, but the minute we get their ears clean, they're like, oh, he's going for a bath tomorrow. So just please remind the client that there's, they can't do a bath. They can't give the pet a bath or to go swimming for, until we do the follow-up. I say 4 weeks is what I usually tell them. So just make sure you're telling the client that so they're not just flushing it back out the ears. But as far as maintenance, after the pet's ears are better, I usually do the Tris or Tris Keto and just have the owners do like a once a week ear flushing as a maintenance.
Yep, agreed. And then T asks, is Orison okay before Claro? That I'm not familiar with that flush.
I just looked it up and it looks like it is drying and acidifying. So probably not, huh?
Yes, Dr. Lewis says it needs to be neutral or alkalizing.
Yeah, yeah. I was trying to look up the ingredients because it doesn't say, there's not much on there. It's just like, oh yeah, it does, all the things that your cleansers do.
Yeah.
So that's actually super important. Like that's probably my biggest takeaway from today because we use Claro a lot and we also clean with Orison before. And I do feel like we see a lot of Claro failure and we honestly do a lot of Claro like repeats, like Claro and then a month later like another Claro because it failed. So I definitely am going to bring that up.
Yeah, if I'm having to apply another Claro, I'm doing an ear culture because I mean, so if you're having to do that many, that's why I had to call the company because I was having so many failures at this one clinic. But if I have to apply Claro twice, I'm probably going to do ear culture before I put something else in there.
Yeah, I mean, we will do like cytology and see, like the same stuff happening. Unfortunately, we don't have, the resources to go all out. So we're like, what do we do again? Claro again?
If you are using an acidic one or a drying agent, you just have to wait like 30 minutes or more until it's completely dry before you put the Claro in.
I see. Okay. Thank you for that.
Yeah.
Ursernia, Claro. Yep, we talked about all that stuff. Okay.
I like Ocernia. My only issue with that is the client has to come back in a week and then they have to come back in 2 weeks after that. And when you increase the frequency, you decrease the compliance. I mean, if it was just once like Claro, I would probably use it. I like that one because it has the gel, like the gel base versus Claro is like very watery, but gosh, if they could get that just a one treatment.
I mean, I've been to some clinics where they'll like pre-COVID when the client was actually in the clinic, they would apply the first one and show the owner how to do it and then send them home with the other one and say, apply this on such and such a date, like whatever the 1 week apply date was, and then say, come back for the recheck after that. So I have definitely seen that as well. If you have clients you can trust, a client that's a vet tech or, whatever the case may be, if they're actually gonna do it. But yeah, I agree. That's why I typically don't use the Ocernia, but I have been to some clinics that have that one. Oh, and then Zymox is an over-the-counter one that they can get, enzymatic cleaner with hydrocortisone. That helps, again, just with kind of after they swim and random little things.
I've never had good success with Zymox alone.
I have like more of like random itchy ear, not infections though.
Sure.
Okay, so quickly, we're gonna wrap this up here in a sec so that you guys have time for questions and we can get you on your way. Food allergy, long story short, and you can read the slide, is that, again, expectations with them and just letting them know that if they're not going to follow all the rules, don't waste your money, don't waste your time on it. If they have a cat that goes outdoors, it's probably getting next door neighbors' food that they left out. So being very mindful of people that want to do that. The two biggest takeaways would be no raw hides and the hooves and the bully sticks and all that stuff. They can't have any of those. So the acceptable treats, most or if not all of them, Royal Canin, Purina, and Hills all have their own hydrolyzed version of treats. Pill Pockets now makes a duck and pea formula that's supposed to be their hypoallergenic. I was at a clinic where a doctor said they'd called to some derm somewhere and they said that bananas are actually a hypoallergenic treat. And so if they want to use that to stick the pill in, they can use bananas for their dogs. And then baked potato as well apparently is a thing that they can use. And so if they want to slice that up into cubes and using that as well. But preventatives is also a big thing that they can't do. So maybe do like Pro Heart or Topical Revolution or something. But a lot of things to keep in mind when we're going to do the food allergy trial. Okay, and then we'll skip through this, but autoimmune are some of my favorites. You do see them in small animal practice and general practice a lot more than you think you do. And so the biggest thing is just knowing where to look for the answers with it. And so when you start to see these nose dogs and things like that, you know, starting to look for lupus and things like that is a bigger thing. And I see you in the chat. New preventatives, Simparica Trio, NexGard. I think what I was
I think Brevecto is supposed to be hyperallergenic.
Brevecto, I believe it is. I know HeartGuard definitely is not. Simparica Trio is. NexGard, I don't know. I don't know about NexGard. Let me see that guys go in the chat. So yeah, so lupus, this collinose thing, if you start seeing the pigment changes and stuff like that, sometimes it looks like this. So it looks like they were just rubbing their nose on their blanket. And so again, being mindful of the fact that there are autoimmune diseases out there, and ideally you should do biopsies. A lot of people won't let you. And so there are different treatment trials we can do there at the bottom. And again, Derm Books and Vin is awesome about it.
One quick thing, I'm sorry, with the nose, I had a dog that presented that I could have sworn was discoid lupus, but the history helped us. The dog had been swimming in a river and he actually had blastomycosis on his nose. And we don't see blasto here very much in Virginia, but it's always one of those where, you know, part of the history, you know, the dog didn't have like the, you know, the coat color or anything that would have made me think of like lupus, but the client said, gosh, he was swimming in the river the other day. Now he has this open lesion on his nose. And apparently like blasto gets inhaled and causes nose issues. So cytology, again, actually helped us to figure out that the dog had blasto.
So things that we, you know, we always say, oh, we don't see this type of stuff, but we do. And they are things that can be managed in general practice. And so, you know, I had one at one place the other day that came for a second opinion because the previous place said that it probably had this. And they were like, oh, so you need to go to dermatology. And I was like, or we could just start them on some meds and see how they do. So it's definitely, it's you can do it, is the bottom line of this here. So again, same thing with pemphigus. When you start to get all the crusty stuff, autoimmune things, 3 weeks later, it looks even worse, but with some treatment, again, you can do this. Easy medications, it takes a long course, but you can do it. And people will be a lot happier being able to see you in general practice instead of having to go to derm. But referral is always an option, but sometimes it's not. So just knowing that it's there. Same thing with lymphoma dogs and stuff like that. Those, once you get your biopsy, refer those.
Yeah, I was going to say the one case, I've seen one case of cutaneous lymphoma, and the presentation was just a 2-year-old miniature Schnauzer that presented as if she had atopic dermatitis. She was minimally, this was before Apoquel and Cytopoint, so we had steroids and Benadryl. So she was minimally responsive to steroids. She had no skin lesions, but she was a 10 out of 10 itchy. With steroids, we could get her down to like a 5 or a 6. That just didn't make sense to me. And so we biopsied her skin and she had cutaneous lymphoma. So, you know, I always say if it doesn't make sense, and all of our doctors on our team always laugh at me because I always say it's cancer, if it doesn't make sense. But if it doesn't make sense, it's probably autoimmune or cancer. So those are the things that you got to keep in mind. If it's a dog that has allergies, it should respond to steroids regardless. I mean, even, you know, but this dog was just minimally responsive. And so I just told the owner, I said, I've never seen anything like this before, but we should probably biopsy the skin. And it was lymphoma.
All right, so we said biopsy. Okay. Oh. Hold on, I'm trying to get the chat away. And again, the last one, this one is also one that we see more often than not. And people say, oh, his toenails are just getting brittle. But they shouldn't be brittle at 2 years old. And so something else to keep in mind when all the feet are affected and we're getting these crusty things. A lot of times there is a secondary infection. So take the cytology around the nail base and getting them on some type of a medication. I've probably already seen, 4 in my 6 years of practice. Most of them were actually German Shepherds. I did have a golden or a lab, I think, once too.
And these dogs feel better if you treat the infection at the same time that you're putting them on steroids. And, I mean, for a while in practice, I would just treat, steroids with etoxaphylline, but I now know that you got to get that cytology and treat that secondary infection. And those dogs are so painful when they come in, but once you get them on the appropriate therapy, they quickly get better.
So those are my forgotten 3, but I love those because we see them and we just, pass them off or just do the infection that comes back. Real quickly, I promise. Cats. Fleas, that, eosinophilic granuloma complex, the rodent ulcers on their upper lip, plaques on their ventrum, stress over grooming. So again, asking history, if they've been moving or new cats in the house, ear mites. If anybody has seen the big purple kind of bubbles in their ears, these ceruminous ear cysts they see a lot. Again, responding to steroid, Dr. Starke said she likes to use the depot on those. I like topical with them as well. So the cyanotic drops work well for those as well. This is typical flea allergy kitty cat.
So my disclaimer for the Depo-Medrol, because I don't use Depo very, very often, but there are particular cases. It's the client with the cat that's itchy that they can't medicate. I let clients know that this is a steroid. It's a long lasting. These are the side effects. But in some of these cases, this cat's not going to get prednisone twice a day or even once a day. And so, you have to think about patient comfort and just, talking to the client and just communicating with them that this is not our most ideal scenario, but it's what we got. And so, but then the cats are generally feeling better, especially one like this. It's a flea allergic cat. This cat's going to be better. You give it a Depo injection, by the end of that day, the cat is feeling better. But I also am going to have the conversation and say, ideally, I want you to give this oral prednisone, to get the itching under control. But just knowing the case that you should consider using it versus not just throwing Depo at every cat that comes in the door that's itchy.
Depo convenience, send them out the door.
Right.
Treat them. Here are those cysts we talked about. They usually have a secondary ear infection just because it's so stenotic in the canal. And then of course your classic ear mite cat. Meds, convenient, of course. You can use Apoquel off-label actually in cats. So again, explaining to the owner that it's off-label, but it works well. I've actually had a couple cases that it worked really well for them. Atopica, we talked about the ringworm, Tresiderm. Claro is our newest be careful thing that we've learned personally. Before, again, it's off-label, but we're using a half tube in each ear, and a lot of doctors you talk to have done it, and a lot of you might have done it as well. And then a couple cases, I probably, 2 within a week from different clinics that I was at, said that the cat ended up with vestibular disease. And so, again, it might definitely work. But being able to let them know and documenting the fact that you told them, hey, this might happen, we might have an issue, but what is the, risk versus benefit of an untreated ear infection in your cat? And if you can't treat them at home with Tresiderm 2 times a day, we might just need to try the Claro.
Dr. French, I remember that one case that we were following up on, but I know, did it resolve?
I don't know. As the last I heard, it was over at Dave, was whoever's there next.
Okay.
But last I heard, it had started to improve, but they had to go to like the ER and be on fluids and all types of stuff.
Okay.
So I'm not
That's
sure.
a bummer.
Yeah, I'm not sure
Okay.
how it ended up for that one. Dozer apples. Thanks, Dr. Kraut, for fielding that one.
So I was just going to say, just too with cats, what owners will say when you're getting history, this is where history is important. I can't tell you how many cats that owners are like, oh, he's an indoor cat, but do y'all have a dog? And so if the dog goes outside, then you can treat the cat for fleas. And I don't let owners talk me out of treating fleas. I just use more creative ways to tell them that we're going to treat. I say, let's treat for ectoparasites. And I break out the neck guard, or for cats, I'll break out the revolution, but don't let clients talk you out of treating for fleas, because the last thing you want to do is send that cat to a specialist and they call you back and tell you they found a live flea. You want to make sure that you're ruling out the easy stuff before you're sending that cat to the dermatologist. And for dogs as well. If, we're having a conversation about allergies, I'm saying, listen, let's treat for ectoparasites, because clients are commonly in flea denial. They don't want to admit that they have fleas, or that they don't want you to insinuate that they're dirty. So usually if I say ectoparasites, that goes over a little bit smoother, but do, as part of getting your history, see if they have a dog in the house, if that cat's an indoor cat that's itchy and has that distribution of being at the base of the tail where all the hair is gone. So just keep that in mind with clients.
And I also asked to say, hey, does she ever sit out with you on the patio? Because you always say, well, she doesn't go outdoors, but then they say, well, she's in the fence, in the enclosed patio with us or something like that. So fleas can get in there too. They don't stop at the patio door. So I don't think they understand that sometimes too. Okay, resources. This is a favorite slide. If you're going to take anything, take this slide with you today. So VIN, if you're not a member of VIN, definitely become a member of VIN. I type on there about all types of questions and answers in all these cases on there. Veterinarypartner.com is my favorite. Basically a VIN for owners. And so you don't have to have a login or anything for that. I go on there 20 times a day, type in atopic dermatitis, otitis, whatever, and print that out and send it home for the owners. And it goes through all of this that we just talked about the fact that it's going to be a long thing and it's not going to get better or it's not going to go away and things. So definitely veterinary partner handouts.
And they do have it in other languages as well.
Yes, understand. Yes, and you can put it in different languages at the top right corner of your veterinary partner. There's a drop down menu where you can translate it to Spanish and all types of stuff. So I've used that before as well. Absolutely. And then also document that you sent them home with a veterinary partner handout on whatever you sent them home with. So when they tell the next doctor that you never told them that this atopy thing was a big deal, they can say, well, did you get that handout that they sent you home with? So I always document that. LifeLearn is kind of like a veterinary partner, easy to understand lingo for owners, but you do need a login for that. So clinics, again, if you have decision-making power or can bring it up, it's good to have a LifeLearn thing. And so basically they will have a handout and it has your little clinic logo on there with the information. VCA hospitals, under their Know Your Pet thing, they use the LifeLearn. So a lot of times, if you can't find it on VIN, and you type in VCA and then whatever it is, VCA atopic dermatitis or whatever, it takes you to their LifeLearn page. And so that's kind of a backdoor into getting some other information for clients. And then the bottom one, the Zoetis one, is actually one I found the other night when we were preparing this lecture. Awesome website. I did not know it existed, but I wish I did. It is basically like a dermatology book online, an easy type of stuff. So it tells you all the diagnostic techniques. So how best to do the skin scraping, how best to do this, that, and the third. It tells you what you need to use it, when you should use it. It has pictures of results and things like that, all open to the public and open to you to look at. In the veterinarian reference handouts, again, it's kind of like a mini PDF of whatever your topic is for you. And it has drug dosages. So if you had, say, that lupus thing, you type it in there, it gives you a whole PDF on signalment and all that type of stuff. So I found that the other day and I wish I had had that sooner. So I do recommend that as well.
There was a question, or there was a question from Brianna. Did you see that one?
I did. And so our lovely teammates here from All for PAWS have answered her, which is awesome. So thanks, Dr.
The food one, the one about food?
Mm-hmm.
Oh, okay.
So just so everybody, in case you didn't see it in the chat, Brianna had asked about over-the-counter diets for owners who can't do food trials or don't want to, and stuff like that. Dr. Lewis had said she uses the Purina Pro Plan sensitive skin. I agree. That typically works the best, in my opinion. I don't know if you've used anything else, Dr. Starke, as far as that goes.
Not over the counter. I mean, I do tell clients, I do tell them that you can change the protein source in general, but I do warn them that, I say to them, I like Royal Canin because they're the only ones that have passed the purity test. So all of the foods have been DNA tested. If they say they just contain venison, all of them contain chicken except for Royal Canin's foods. So I start with that. And then if they say I can't afford it, then I would say, then just get a protein source that's different from what Fluffy's eating. You want to avoid turkey because it cross-reacts with chicken. You want to avoid, you want to avoid beef, you want to avoid chicken and turkey. So I kind of say, get something as novel as you can. But again, like Dr. Lewis said, I do explain to them that it's not truly hypoallergenic. But again, sometimes just switching them to a different protein, even if it's not a hydrolyzed or the Royal Canin limited ingredients, then it still is sometimes worth doing it if you really suspect a food allergy. But if they don't respond, then I still don't rule out food allergy. So it makes it kind of tricky. But
Have they spent the time and money on that? So I usually just ask them to, make the investment for that 8 to 10 weeks. And then if not, then it's not. But at least we tried.
Right.
And the other question was about the Apoquel off-label for cats. And so Dr. Kraut, I agree. It's definitely higher. I don't know the amount offhand, but if you don't already have it, for everyone, the Plums app, get that on your phone for sure. So you don't have to track down an actual hard copy Plums, but I use the Plum app on my phone all the time. But
my
yeah,
friend does only cats. She said she just uses a similar dose for cats as we do for dogs. So she hasn't used the higher dose. She says the patients that she has have responded to just the regular 0.4 mg per kg to 0.6. So
yeah, I love my Plums app. That and the Target app I use a lot too. And these are my boys on the questions page. That's Tanner on the left, my little Shih Tzu Pom. And then the picture on the right is him with Jake, who's my parents' dog. He's a Maltese Shih Tzu. But I have, thankfully, thus far, across my fingers, they're high vigor. I haven't had any allergy, anything. I know, that's what I said. But they're 9 and 7 now, so.
Well, if you develop any, I got you covered because my Frenchie in Boston have taught me a lot. Any other questions before we?
Sorry, we took over your time. Derm is huge and extensive, and obviously you guys know that. So much more that could be covered, but those things, and again, even though it seems like a lot, that is probably 70 to 80% of my day.
Yep.
With ears and skin and itchy and that type of stuff, especially when it comes to recheck appointments. And so making sure people understand the value of recheck appointments and why the follow-up is important is definitely the takeaway of derm.
And treat for fleas, even if it's indoor cat.
Right. Does anyone have any questions? Melanie, if you wanna, perfect, yeah, we can get everyone on here. Thank you guys for such an awesome presentation. I was like, it was so thorough. It was so good. Does anyone have any questions? Or even comments, like things that you want to discuss?
If you learn any new stuff, any extra notes for us?
Yeah, cases that you might see.
We're learning.
Why was this rounds important to you? For me, it was because I use Claro so much, and I actually was able to take away that we're probably cleaning the ears improperly before instilling Claro. So that was huge takeaway for me tonight.
Clinic, we were like, when I first started out, I hated Claro because it just never worked. Never worked.
Exactly.
And I don't remember what we were using, but it definitely wasn't Triz, that's for sure. And then when I joined the team, they're like, oh, we love Claro. And I'm like, but it doesn't work. And they're like, oh, it works. And yeah, mind blown for me too. But it just never worked for us. And that was why.
I know that Brianna.
Well, it was only one clinic doing relief. It was only one clinic that it didn't work, which was kind of concerning. I'm like, why is it only not working in the dogs on Leesburg, Mm-hmm. But it was the clinic.
Brianna, did you have a question or a comment?
No, I was just going to say thank you guys. And I'm really interested in the ringworm PCR because I forever just put my cultures in the drawer and then I can never find any.